Good morning from the Finnish Kidney and Liver Association in Finland, Helsinki, and thank you for joining us today. My name is Tarja Teitto-Taket, and I am working as patient advocate in liver disease area. In our organization, we also follow latest developments and research in liver world, and I have the privilege to learn about today's topic and finish high-level research by Dr. Aito Kari, and also to cooperate with European Liver Patient Association with a number of years. Today, together with Beatrice Credi, ELPA Head of Office, I have a privilege of speaking with Dr. Linnea Aito Kari, a medical doctor specializing in general medicine and accomplished researcher. Dr. Aito Kari recently completed her doctoral dissertation on the prevalence and screening practices of liver disease in children, focusing on conditions like metabolic dysfunction-associated steatotic liver disease and liver enzyme abnormalities. Her groundbreaking research highlights the increasing prevalence of fatty liver disease in children, especially among those with obesity, and advocates for more precise and age-specific screening practices. This work is not only pivotal for advancing our understanding of pediatric liver disease, but also emphasizes the importance of early lifestyle intervention in mitigating severe outcomes. Currently practicing at Valkeakoski Health Center in Finland, Dr. Aito Kari combines her clinical expertise with her passion for research, striving to improve healthcare practices and outcomes for children. Today we delve into her research, the implication of her findings, and her thoughts on how healthcare system can better address these pressing issues. Welcome, Dr. Aito Kari, and thank you for taking the time to share your insights with us.
Thank you for inviting me. I'm very glad to be here, and I think we shall have very interesting conversation today.
I'm absolutely convinced about that. So to go into your sort of research, so can you explain what this ALT reading is all about and why it's important for understanding liver health, especially in children?
So ALT stands for alanine aminotransferase, which is liver enzyme participating in protein metabolism in liver cells, and when liver cells are damaged, ALT leaks to circulation. And we can measure ALT levels from blood test, and its levels are typically low. And ALT levels increase after liver cell damage, and it is very frequently used marker for screening and diagnosing liver diseases, especially in children. And ALT can also be used for follow-up liver diseases, and decreasing levels in circulation often indicate that the disease is getting better. Of course, beside ALT, we can study liver structure and diagnose diseases by imaging studies or liver biopsy. However, liver imaging studies are not available in all small healthcare centers, not in every primary care practitioner's office, and also they can be sometimes difficult to conduct on children. For example, even anesthesia might be needed in some cases. And furthermore, liver biopsy is expensive and invasive procedure and even can result in complications such as bleeding, although these are quite rare. So we have to consider carefully before we do it that it's really needed. Therefore, compared to these methods, ALT is easy and can be easily measured, and it's also cheap and available in primary care. So that's why we use it often in children.
Right. It really makes sense. So But what inspired you to explore this ALT testing and its implication for children?
Yes, this is interesting that in clinical work, ALT is very frequently used, and I often encountered abnormal values. But however, there is very limited recommendations on when to measure ALT and how to proceed when abnormal levels are encountered. So there was clearly a lack of research and recommendations.
Right. Your research highlights the gaps in ALT testing recommendation for children. Why do you think this area has been overlooked?
I think that in the past there were less knowledge about liver diseases in children and they were considered very rare. However, a lot of new information about liver diseases in children has emerged recently, and many new liver-related diseases have also been identified. And also, the use of medication affecting liver has increased among children. So currently, we have more knowledge that this is a relevant subject to study, and it's getting more and more common, and we need this information.
Right. So you mentioned the connection between ALT levels and conditions like obesity and celiac disease. How do these findings help us better understand these conditions in children?
Yes, in my study, I collected all ALT measurements conducted on children during 30 years in Tampere University Hospital, and I discovered that elevated ALT levels have become more common in children, and this is likely due to increasing prevalence of obesity and other liver-affecting diseases, such as autoimmune diseases like celiac disease. And in fact, autoimmune diseases and liver-affecting medications, as well as metabolic dysfunction-associated liver disease MASLD, were the most common causes behind elevated ALT values in children visiting Tampere University Hospital outpatient departments.
Okay.
This information is very useful for clinicians encountering children with elevated ALT levels in their clinical work, because knowledge about the prevalence of diseases helps to determine which conditions should be investigated first and which ones to suspect if the initial suspicion is not confirmed.
Okay. So what did your study reveal about the difference between the current ALT cutoff and the never lower thresholds? Why does this matter?
Yes, in my study, I investigated ALT reference ranges, so typically upper limit of normal, in this large data set of healthy children. And I discovered that the reference ranges that we currently use are maybe too high to detect early liver diseases. Additionally, I found that these reference ranges should be adjusted based on a child's age and sex, because currently we have this one cutoff for all children. So this might not be optimal for everyone. And incorrect reference range can delay diagnosis, and it can even lead to disease progression to more severe stages. So this is a very important issue that we have optimal upper limits.
Right. It sounds really quite a profound finding, what you are explaining here. Thank you.
Thank you very much for this first part. So before continuing, I would like to thank Staria for inviting me and Dr. Aitokari to discuss this important matter. And I really would like to continue focusing on this new cutoff because that's the key findings of your research. But it will be interesting to understand also for the liver patient and the liver patient community, how could we really use better ALT cutoff to diagnose and manage liver-related condition in children in a practical way, so in a day-by-day medical practice.
Yes, this is a good question. So these appropriate reference ranges or upper limits are crucial for detecting liver diseases early, because many liver diseases can progress to more severe stage and they can be more difficult to treat. And it can also be frustrating for a patient when there is no explanation for their symptoms. So this is particularly relevant for conditions such as MASLD, which should be identified promptly to halt its progression through treatment. I think that clinicians can utilize this information from my study to interpret ALT results in relation to child's age and sex when considering the need to further investigate possible liver disease.
The health, the liver health, let's say, community, both patient and doctors are aware that there is an increasing childhood obesity rates related to a rise in muscle, as you mentioned before, so the metabolic dysfunction associated steatotic liver disease. Always on a practical level, what steps can parents and healthcare providers take to address this trend, which is a real trend?
Yes, I think that the rising prevalence of obesity and muscle already in childhood is very worrying. And as healthcare professional, we must strive to eliminate the stigma still associated with obesity and recognize obesity and MASLD as a multifactorial disease. It's a wider situation than just about one's own lifestyle choices. So there is many factors contributing to this disease. And in my research, I investigated the prevalence of MASLD in children, and I found out that even though the prevalence was slightly lower than in other countries, it was still surprisingly high. And we should really, as a healthcare professionals, actively work to identify all at-risk individuals and provide appropriate treatment and support for all of them. And I think that this eliminating stigma is essential to remove also the barriers that prevent families from seeking help. There are also many ways that parents can do to support children in developing healthy sleeping, eating, and exercise habits.
Your research is also related to celiac disease, and your findings suggest that frequent ALT testing related to this disease might not be necessary. How can this streamline healthcare for children with celiac disease?
Yes, I also studied the prevalence of ALT elevation in children with celiac disease because previous studies indicated that even half of the patients can have elevated levels and liver disease at the time of celiac disease diagnosis. But I noted that this liver disease has become very rare also in children, and similar findings have been discovered in adults by other researchers. And the reason behind this is likely improved diagnostics, for example, risk group screening. And I think that this supports the idea that we need to screen risk groups and identify the disease early, because in some patients, the ALT was already a little bit elevated, but not above the upper limit of normal, and it decreased during the gluten-free diet, indicating that we could prevent this liver disease if we start the treatment early. And I also noted that this liver disease healed very well in children during the strict gluten-free diet, which is currently only treatment for celiac disease. And this indicates that we don't need to follow so closely everyone and take very regular liver tests if there is everything going well with the gluten-free diet. And this could save families some valuable time and also save some healthcare resources.
That's very interesting. You briefly mentioned at the very beginning that you gather and analyze a large cohort of children. What were the biggest challenge you faced in gathering such a big amount of data?
Of course, the data collection took a long time, and during that, there were changes in national data handling regulations, which affected data collection. But however, I think that all that effort was worth it, and we are still utilizing this large cohort in many interesting study questions. But it was challenging sometimes.
I can imagine. And you collected just data from Finland. Is that right?
Yes.
It would be very interesting having the same data from other country, or see if the findings are relevant also outside Finland. You think that you are going to continue investigating this topic also from other country perspective?
Yes, I think it would be very interesting to conduct similar studies in other countries, because in Finland we have a relatively homogeneous population, which may increase internal validity, but might reduce generalizability to the result of other countries. So for this reason, it's very essential to conduct similar studies in different populations.
Very interesting. Over to you, Tarja. Thank you.
Yeah, thank you so much. It is good to hear, that all your research as well has been resulting that the data can be utilized elsewhere as well, and the research questions can be developed out of it, for the future. I would like to ask a little bit more about the broader implications, and as your research links the ALT testing with metabolic health in children, do you see this is a wake-up call for addressing broader lifestyle factors like diet and physical activity?
Yes, I believe that this increasing prevalence of abnormal ALT levels and rising incidence of muscle in children serve as a warning sign, highlighting the need for societal actions such as policy changes that encourage to develop healthy lifestyle changes.
And what do you think, what kind of a role schools and communities can play in preventing liver-related conditions linked to obesity and malnutrition?
Yes, I think it's very important to tackle this epidemic in many different areas of life. And in Finland, we provide this free school meals for all children, and the nutritional values of these meals are based on evidence-based Nordic nutritional recommendations. And children in Finland also often walk or bike to school. So this is supported by an extensive infrastructure that promotes this active transportation. However, I believe there is still many ways that we can improve this. and encourage even more participation. I think also supporting children's opportunities for hobbies and ensuring they have these positive experiences with physical activity is very crucial. So these efforts can help to develop lifelong appreciation for active lifestyle.
Yes,
I think
yes.
also that supporting mental health of families and children is very crucial because today's work culture is often inflexible and does not meet the need for families with children. So balancing work and family responsibilities can be very challenging. And to better support families, I think workplaces could adopt more family-friendly policies, such as like flexible schedules, like parental leaves and childcare support. And I think that dietary habits could also be guided by clear packaging labels and legislation and like harmful product tax, which we have just now improved in Finland. So we will see in the future if it's effective. But there is many ways that we can improve this situation.
Yes, that is, I will absolutely support your ideas there. And furthermore, I think that in Finland, because we still have a lot of space and playgrounds and different activities available, so it's not because that we wouldn't have it. On the other hand, it is probably due to how the balance in parenting and work and home and children, how do you put this kind of a sometimes a very demanding puzzle together so that everybody can benefit from it. So
Yes.
yeah, so what do you think then in the future? So what are the next steps in your research, and how do you hope to influence clinical practices?
Well, I hope that my research will contribute to development of screening recommendations for MUSCLed. And I also hope that this research will be useful for clinicians who are considering how to proceed with differential diagnostics when a child is found to have elevated ALT levels. And currently I'm studying which kind of care children with obesity receive in our public health care and which treatment methods appear to be most effective. And I'm also researching new biomarkers for early detection of MUSCLed, and I hope I will be able to contribute to these identification and treatment practices we currently have in our public health care.
That really sounds very
Yeah.
exciting, yes.
I'm also looking for a postdoc position abroad to continue my study and learn new methodology.
Okay. I would like to go just for one more time, would step back one step, and to ask about this your research that if you could implement one immediate change in the way of how the ALT reading is used in pediatric healthcare, what would it be?
I think that better recommendations for ALT testing are urgently needed because we have overuse and also too low screening rates. So based on my research, there is currently excessive use of ALT testing in case of common infections, such as upper respiratory tract infections and gastroenteritis, because in this situation, ALT levels are typically elevated and follow-up testing then leads to unnecessary burden to families and healthcare. And on the other hand, my research indicates that muscle is not yet comprehensively screened in all children who are at a risk of developing the condition.
Right. And there would be also still another question for me, which you have partly answered already, and which is yet again the new diagnostic tools or treatment for for the conditions of the muscle. But you were sort of explaining already that you are widening your research, sort of understanding more about what the findings could be, or what how it can be diagnosed probably easier. Is that so?
Yes, we have currently an ongoing research about these biomarkers to identify muscled patients early, and there is also very rapid international development and research interest about this issue. For example, Panu Luukkonen and Hannele Ykijärvinen from Finland have contributed on recognizing different phenotypes of muscles, which possibly needs different kind of treatment. And also, I think that research on muscle medication is a very hot topic, and I think that we will have many novel medications for muscle within next 5 years. I also want to mention this Finnish study by Professor Hani Elnesmi that found that this resistance starch alleviates liver steatosis through gut microbiome alterations. And I think that we have still a lot to discover about connection between nutrition, microbiota, and muscle. So there is a lot of topics still to study.
Yeah, thank you. This is very interesting to hear what you are saying. I'll hand it over to Pia to say it again. Thank you, Linja.
It's very interesting indeed, and I was listening to you. I was really fascinating about this mix between new treatment, prevention, and both prevention related to screening, but also prevention related to big public health action to tackle the social and the commercial determinant of health, or to improve healthy lifestyle. So it was really, really interesting listening to this mix of action that we can really put in place. Just out of curiosity, was there something that surprised you, a surprising discovery during your research journey that I suppose has been also quite long?
Oh, yes. I was surprised by the amount, how little information was available on the prevalence of muscle. There were no data about it from Finland before my study. And also I was surprised when I contacted our laboratory professionals and asked where these current upper limits for ALT are coming, and they didn't know the basis of these current ALT reference ranges, even though these are very common issues to struggle with in everyday clinical practice. So it was surprising how limited information there still is, and it's also surprising that we don't still have a lot of effective medications for muscle, and even though it's so common.
The data is the lack of data is again really it struck me because it's Finland is not I mean, it's a country we expect some a lot of resource, but the lack of data is something that is really common in liver disease and in healthcare sometimes in general, especially sometimes in very specific areas. So it's really interesting that you found this you struggle in finding data. So child health, but muscle as well, is now part of a global conversation because it's a global is a global issue. How do you think your findings can contribute in this bigger picture?
Well, I think that my research provides new insight into ALT reference ranges and muscle screening, and it highlights the need for careful consideration when establishing these reference ranges in international guidelines.
And before wrapping up and leaving the floor to Tarja for the conclusion, we are talking about children, so we are talking about parents as well, because they are responsible for their health. Is there a way for parents to be successful in monitoring their children's liver health?
Well, I think overall it's important to recognize that these liver diseases and use of liver-affecting medications in children have increased, and the possibility of liver disease should be kept in mind. However, there should always be good reason before we take laboratory tests from children, because children have a lot of infections, and like I mentioned, there can be a lot of these temporary causes that can cause elevated ALT levels, and then can lead to worry and family burden. So we need to always consider carefully before testing children.
Thank you very much. Very, very interesting. Tarja, the floor is yours.
Yeah, thank you so much. The latest what you are saying about this, the children, the parents shouldn't be worried more about the children's health than necessary, so that it can be maybe all the kind of measures which we might be recommending later on, how to take care of the diet and also all the activities and all and everything, so that it would be easier to embed into everyday life. In keeping that in mind, so I think that the communities and countries, they would need to influence policymakers, what to do, how to conduct a good, healthy, normal life living, overall, not burdening anyone too much. So what would be the message, from you as a researcher to the policymakers, addressing these liver sort of health issues overall in families, not only the children, but families?
Yes. I think it's important to realize that even though in Finland we provide regular, free of charge healthcare checkups for children, we have not yet overcome this rising prevalence of obesity and muscle. And it's crucial to recognize that only a small part of this epidemic can be managed through healthcare interventions, while these societal changes and regulations promoting healthy lifestyle have a central role. So it is important to acknowledge that this is a complex issue and not solely related to individual choices. So we have a lot what we can do. Like I mentioned earlier, this more flexible work culture and providing opportunities for physical activity in children, and encouraging to have these physical activity hobbies and transportation and playing outside, and also to guide people to choose healthier food products, like this package labeling and harmful product taxes and things like that. There is a lot to do And there is actually some positive examples that this kind of procedures can work. Like, for example, we have managed to decrease tobacco product use and alcohol consumption by this kind of methods. And also in United States, there is now some positive news about these policy changes.
Yes. So thank you. I think it is very encouraging to hear as well that there are measurements which have been proven to be successful. And let us hope that that all the policymakers as well as the healthcare professionals, particularly doctors in the primary care, so that they will listen to you and they will start considering maybe better advice and more sort of careful listening what is going on within the family when they are diagnosing and when they are starting to recommend anything. And I think that I wish you all the best for all the further research you are doing and all the findings and all the interesting areas that you will be discovering in the future. And hopefully we will see you in one lovely European country doing further research in this field. So thank you ever so much. It's lovely to have you here today. And many thanks.
Yes, thank you. It was very nice conversation.
Thank you very much. Yes, the liver patient community needs people like you. So yeah, also to push research further. So thank you very much for joining us today.
Thank you.
And good luck for your future endeavor. So
thank you. So future studies are still important, and we need to support researchers and encourage to conduct more research about this issue.
Absolutely. Thank you very much.